Hi folks, I'm Dr. Ed Beyer of Beyer Natural Health Solutions. I've been practicing functional medicine for over 33 years, and one of the most common disorders that I see are chronic digestive issues. We're going to go into today a lot of information on how, through functional medicine, you can put whatever digestive condition you have into remission through functional medicine. Now, you need to understand that there's this huge difference between traditional medicine, gastroenterology, and functional medicine. With traditional medicine, as many of you already know, they do a lot of testing, a lot of imaging procedures, and that ultimately leads to some sort of pharmaceutical or medication, correct? Or surgery. They're not interested, they're interested in what you have, but not why you have it. And functional medicine is kind of the opposite, right? We're interested in doing proper testing to identify and remove what the true causes are of digestive dysfunction. So we got a lot of information to share with you. I'm gonna get right into it. So I'm gonna go over the 10 underlying causes. There are more, but the most common ones that I see, 33 years of doing this, to chronic digestive problems. Here's a list of them, and let's get right into it. The first one that I see very, very commonly, and I'm probably gonna spend more time on this one than any other of the rest of the 9, is low stomach acidity. This is known as hypochlorhydria. People have this, they don't break their food down quick enough, and so then the food sits there too long, you get bloated, and the acids you do have, which are insufficient, they get pushed upwards. So many people think that reflux or GERD is due to too much acid. You have too much acid here because you got too little down here. The other thing is every time we eat, there are germs in our food. So if you don't have enough acidity, we get these chronic infections like H. pylori. It's also going to change the pH throughout the gut. And we need proper acidity, believing that when the food leaves the stomach, the proper acidity will trigger pancreatic and gallbladder function. We'll talk about that a little bit too. So when we have low stomach acidity, that changes the whole environment of the gut. So the microbiome, the normal bacteria that exist down there, get altered. It's kind of like not having the proper pH in a pool. Certain things won't grow and certain things will overgrow. So poor gut microbiome due to poor acidity, that's what causes irritable bowel syndrome. But it also can be a trigger to autoimmune disease, cause leaky gut, cause poor immunity, and we see chronic infections. We can see motility problems like constipation and diarrhea. Also, when the stomach is not producing enough acid, like I already mentioned, the pancreas isn't triggered, and you're gonna get bloated like an hour and a half after you eat, and then you have malabsorption because we need the pancreatic enzymes to absorb our nutrients. That causes nutritional deficiencies. So there's all this downstream stuff that happens when the gut doesn't work. I will tell you right now, when someone comes to me, no matter what the problem is, we always have to fix the gut first. Low stomach acidity, hypochlorhydria, also does not trigger the gallbladder. So now you get gallbladder problems. You become toxic. You cannot remove your hormones, so you develop hormone imbalances. And then the gallbladder gets stagnant and stones form, and they remove it. So you also get malabsorption and a lot of bloating, poor skin, poor hair. And then the causes of low stomach acidity or GERD are a poor brain-gut connection, folks. There's this strong brain-gut connection via the vagus nerve that, I'm giving you a lot of information, and if you really want to learn more about this, click on one of the links below and I get into this more in detail. But this brain-gut connection is very important. That's why if we feel dizzy, we get nauseous, right? So inflammatory foods, food sensitivities can cause it. Taking things like Nexium, Prilosec, omeprazole, proton pump inhibitors, pantoprazole, that suppresses your acidity. It makes you feel better, but it's making the problem worse. So when you address the underlying issues, then you can go off these medications without having the reflux. Low thyroid, poor zinc are all causes of low stomach acidity. Okay, number 2, low beneficial gut flora, also known as the gut microbiome. The gut microbiome does so many things. There's over 100 trillion microbes that live in us or in our gut or on us. Mostly they're bacteria. These reside in the gut, the skin, mucous membranes like the sinuses, upper respiratory tract, and lower genital urinary tract. So these 100 trillion microbes in the correct amount have extremely beneficial relationship with us. They produce energy for our gut cells. They're anti-inflammatory. They are anti-carcinogenic. They regulate the immune system. They keep our gut barrier healthy. They synthesize B vitamins. They convert inactive K1 into active K2. They remove toxins that we ingest every day. They compete and kill pathogenic microbes. They help regulate fat burning. There's so much research on. You're never going to lose weight if your gut microbiome is off. They help break down the absorption of nutrients. They help remove excessive histamine for those of you suffering from allergies. They help convert glutamate into GABA, which is what you need to avoid anxiety. So the reasons why a lot of us have poor gut flora, if you were born C-section, you missed out on gaining the first mouthful of bacteria from mother's vaginal canal. There was 1970, 5% of births were C-section. 2010, it went up to 31%. If you haven't been breastfed, you're not getting the normal microbiome from your mother. If your mother was not healthy, if you're on antibiotics, not just a medication, but if you're eating foods that have antibiotics in it. So if you have poor gut pH with the hypochlorhydria, if you're taking proton pump inhibitors, antacids, and immunosuppressant drugs, if you have a diet that lacks fiber, fruit, vegetables, and if you have hormone imbalances and a poor brain-gut connection, all will cause poor gut flora. Okay, let's move on to number 3, bacteria and yeast overgrowth. This is known as dysbiosis, a loss of balance of the beneficial flora. It's especially related to inflammatory bowel disease like Crohn's, celiac, ulcerative colitis, and it is the cause of irritable bowel syndrome. It causes allergies. It can lead to type 2 diabetes. There's over 138 studies on PubMed that talk about obesity, diabetes, relating to poor gut dysbiosis. It causes swelling, arthritic pain, and depression. There's over 40 diseases, including cancer, that are related to dysbiosis. So dysbiosis, you have these overgrowths, and then you over-ferment your fiber, and you produce gas. If that gas is methane, you're going to be constipated. If that gas is hydrogen, you're going to have diarrhea. That's what irritable bowel syndrome is. So dysbiosis and restoring normal gut flora is very important. Now, what causes this dysbiosis? Constipation can do it, poor stomach acidity, poor brain-gut connection, taking PPIs. You can tell I do not like these antacid medications, folks. They're horrible for you. You got to eventually get off of them. FODMAP foods, food sensitivities, type 2 diabetes, alcohol can do it, high sugar, low fiber diets. All right, number 4, gut infections. Every mouthful of food that we eat contains germs, bacteria, yeast, parasites. And so if the gut is not working properly, if you don't chew long enough, you don't have enough acids, you get these gut infections, and that is a huge cause of any digestive dysfunction. We identify them through a DNA stool test, and we get rid of them through natural methods. So right here is a list of different herbs and things like oregano and garlic. Many of you know about this, wormwood, that we may use to remove these gut infections and restore the reasons why you had them. Number 5, inflammatory foods or food sensitivities. Folks, the food we eat today is very different than we ate 20, 30 years ago. It's been genetically modified, it's been deaminated, all these additives, and so our immune systems, our guts aren't built to handle that. But there's other foods that can cause inflammation. Sugar is a huge culprit. So is processed vegetable oils like trans fats and hydrogenated oils, dairy, gluten, alcohol, lectins, FODMAPs. All these things will trigger inflammation in the gut. We do testing to determine which ones are bothering you, and we remove them from the diet, some of them temporary, some of them permanently. The food sensitivities and food allergies, much of the food, as I already said, has been genetically modified, and so we're not used to, our immune systems aren't recognizing it, and they attack it, and that is a huge cause of any digestive function. It leads to leaky gut syndrome, which is an increase in absorption of larger than normal molecules in the food, which will trigger an immune response. You got to get tested for this, folks, if you really, really want to get a handle on your digestive symptoms. You know, your gastroenterologist doesn't do any of this. So again, this is a lot of information that I'm sharing with you. You're not going to catch it all, but you can click on the link below. I have more detailed videos that get into this a little bit deeper. Number 6 is gut autoimmunity. Things like celiac, ulcerative colitis, and Crohn's disease. These are autoimmune diseases. With autoimmunity, the functional medicine approach is, why is your immune system doing this? So we identify the triggers and we remove them. So it's very, very different, whereas traditional medicine is just going to suppress the immune system. Number 7 are medications. Aspirin, ibuprofen, naproxen, corticosteroids. These destroy the gut lining. You know, over 10 to 20,000 deaths are attributed due to gut issues to the proper use of these medications every year in the United States. Antibiotics kill the gut microbiome. Birth control pill increases your chance of irritable bowel syndrome by 300%. Acid reducers, antidepressants will raise serotonin, and the gut is loaded with serotonin receptors, so that can cause an increase in gut activity and a lot of different digestive issues. Chemotherapy also will do it too. Number 8 are hormone imbalances. Cortisol, when it's high, will break down the gut barrier. When cortisol, which is a stress hormone from the adrenal glands, is low, you're going to have poor gut healing. Excessive estrogen, which is really common in females, or surge, like birth control pills, taking estrogen, or not getting rid of your estrogens in the body will cause excessive estrogen. That causes gallstones and constipation. Low progesterone, low testosterone will lead to constipation and bloating. Low thyroid will cause low stomach acidity, which is the first thing that we talked about. And constipation. Low melatonin will cause low stomach acidity and constipation. Proper testing, folks, to get to the why. Number 9, nutritional deficiencies. L-glutamine is your best friend in your gut. Our gut lining replaces itself every 3 to 7 days. L-glutamine is one of the main amino acids we need to rebuild these new gut cells that we're constantly getting rid of, called enterocytes. Zinc is important for the stomach acidity and digestive enzyme production. Fiber is actually very, very important. That's a prebiotic that our probiotics, our gut flora, use to eat and feed. Glutathione is a major immune modulator and a powerful antioxidant. Iron supports the gut microbiome. Vitamin D modulates the gut's immune system. And magnesium is very important for motility of the gut and energy production. So we sleuth out these different nutritional deficiencies through extensive blood testing. Number 10 is my favorite. My background is in functional neurology. There's a strong brain-gut connection, okay? And that comes from the brainstem, the autonomic nervous system. There's a nerve that comes from here and goes down to here. And 20% of the fibers are going down to the gut, and 80% of the fibers are going up to the brain. So if that nerve is not working properly, it's a two-way highway, your gut won't work well. So we look at that, we'll see, these are the people that snore, people that have dry eyes, dry mouth, they have problems, they get bloated when they eat and all of that. So we assess proper vagal nerve tone is very important. Folks, if you enjoyed what you learned today, don't forget to subscribe to see more videos, upcoming videos. Also, if you have friends and loved ones that are suffering from digestive problems, please like and share. Please, please, please do that. I'm Dr. Ed Beyer of Beyer Natural Health Solutions. Have a great day.